We as humans, we are limited by our human skills. And 3, 2, 1, and we are back with Coffee Break with Coachman. And as this year starts, we're going to start talking about something that for me represents the future of dentistry. We're going to talk about Dentistry 3.0. What does that mean? And how can we move towards it?
I always ask Christian, like, what are you up to? What are you building? And he's like, well, let me tell you. So we're actually going to do a sneak peek behind the scenes in something that's not even done yet, but it will be done shortly. And you, as a listener, are getting the first sneak peek. You know, every time we chat, it's always a great opportunity to kind of bend our thinking a little bit. And when you shared with me what you're doing now and what you're up to, just describe the why behind this, the Dentistry 3.0 concept, and then let's go into the buckets. What is Dentistry 3.0 and what are you creating and why?
First of all, the name is inspired by an amazing book called Outlive from Peter Attia. And he talks about medicine 3.0, right? And the evolution of medicine. And coincidentally, for the last few years, I've been working on this lecture about what I call reactive and proactive dentistry and how I've been learning with amazing professionals that are trying to see beyond. Basically, as healthcare providers, are we seeing enough? Can we see more? And by seeing more means understanding better our patients. We as humans, we are limited by our human skills. Basically, we are limited by three things. We are limited by what we can see as humans. We are limited by what we can process as humans, our human brain. And we are limited by what we can do with our own human hands. So what we can see, what we can process, and what we can execute, right? Three big bottlenecks. If you imagine the physician of the future, robot empowered by AI in 50 years, you can imagine how this virtual physician will be able to do, or even diagnostician, this digital treatment planner, diagnostician, treatment executor. And the bottlenecks are exactly these three, right? So how can we see beyond? How can we process beyond? And how can we execute beyond? That was my question to myself. And of course, for the last 10, 15, even 20 years, we've been leveraging technology here and there. And basically, when people ask me, why should we use technology, it's basically because of these three reasons, right? We want to be able to leverage tools to allow us to see beyond. So when we document the patient, when we use scanners and CBCTs, when we use all kinds of new tools, jaw tracking, motion devices, sensors to see what is happening with the bite, with the muscles, with the airway, we are basically using all kinds of devices to try to see a little bit more, understand a little bit more, collect a little bit more data, right? How can we use devices so we can see what is going on with the saliva, what is going on with the blood of our patients, the levels of vitamins and hormones and everything that can allow us to see beyond what is going on with the patient. So there's so much going on in the area of allowing a dentist to see beyond. Then we go into, okay, now I'm seeing beyond. There's a lot of information coming to me about my new patient. Now it's about processing beyond. You're overwhelmed with information. You're overwhelmed with reports and bullet points and graphics and colors and diagrams and reports and lists of things and images and visuals and simulations and everything that seeing beyond means. Seeing beyond means very little if you don't know how to process this information, how to interpret the information, how to compare the information, how to put this information in context with the situation of the patient, with the past situation of the patient. How do you compare different types of information in different moments of the patient's timeline. So there's a lot of processing that you need to do. And as humans, we can use our brain, that is an amazing machine as well. We can use our experience to interpret the information. We can use the knowledge that we have, but we know that we can leverage technology to process beyond, to process more information, to process the information faster, to compare this information with millions of other pieces of information out there, to compare the information of this existing patient to all the other patients that we saw, that we have, that other people have. Compare this information with all the scientific publications about the topics that we are exploring with the patient. So it's very easy to agree that we can, with our human brain, we can only process this far. And if we use the tools out there, we can process much more, or we can leverage AI tools to process and summarize, condense, and filter the information and show us what really matters. So the second part, of course, is of becoming a dentist 3.0 is to see beyond, is to process beyond, and then, of course, translate everything that we're interpreting into action. So how do you execute beyond? How do you leverage new technologies to become more precise, to do the right thing in the right way at the right moment, to connect the execution between different professionals that will work on the same patient, to improve the relationship with the lab that is going to be part of the execution of these cases, with the ortho company, with the implant company, with the planning center, with the manufacturing centers, with all these players that are now helping us execute dentistry better, right? So we need to connect all of them. We need to leverage this collaboration better to execute better our procedures. And of course, then we need to understand how can we guide our hands to become even more precise, more delicate, more minimally invasive, to do exactly what we planned, or to execute procedures that will allow us to deliver outcomes that are more similar to what we wanted the outcome to be, right? So before you execute something, you have a clear vision of what is the outcome that you want. That doesn't mean that you're going to deliver that outcome. There's a big difference between wanting to have an outcome and actually getting that outcome. So how do you control all the biological factors, the customized factors from that specific patient that will impact the outcome, the variables? How do you reduce probabilities or chances of having a downside or a negative effect or collateral effect on whatever you're doing? So there's a lot that we need to leverage and learn and explore out there to also improve the execution. So the super dentist of the future is the dentist that, yes, has great eyes, yes, has great experience and great thinking process and decision-making process, yes, has great hand skills to execute. But on top of that, how do you leverage all the new solutions to take these three things to the next level? So basically, by thinking on these three bottlenecks, I started to ask myself, what are the things that are already out there that can help us see beyond, process beyond, and execute beyond? And actually, there's a lot already out there. The dental tech startup space is going through a boom. It's an unbelievable boom of new entrepreneurs, inventors, investors, creators, scientists, researchers that are putting energy on developing new solutions. And the last 12 months has been an amazing experience for me, connecting with all these people week after week, month after month, and seeing how many new things are being developed that has nothing to do with what people see digital dentistry today as, right? Everything that you think digital dentistry is gone, is past, it's part of the past. right? We've been talking about it for the last 10 years, scanning and digital photography and 3D software and digital smile design and digital communication and digital presentations to patients and manufacturing with milling machines and printers and materials. I'm not talking about this. This is a given. This is already the normal, right? Everything I'm talking are things that we wouldn't even imagine 5 years ago. We didn't even talk about it 5 years ago, and suddenly they're all reality. Of course, um, they're strongly based on AI. They're strongly based on body-mouth connection, systemic approach, and they're strongly based on customizing this whole journey per individual, right? Um, they're strongly based on expanding our notion of what a dentist can do to a human being.
Yeah. I love it, and I think it's brilliant. Identifying Peter Attia's framework of outlive is an incredible read if you haven't. And Christian, maybe because I'm older, we have a lot of young listeners. We also have some people that are even more mature in their career. Take us through like how is 3.0 different than 1.0 and 2.0? I thought it was brilliant before we hit the go button how you describe 1.0 and 2.0.
Yeah, I think it was very educational the way Peter Attia explained that in medicine. Of course, the evolution of medicine is slightly different than dentistry. So I did my interpretation and my definition of what dentistry 1.0, 2.0, and 3.0 are, right? We started with, dentistry back, more than 50, 60, 70, maybe 100 years beginning of last century. Despite all the best intentions of dentists at that time, dentistry was very empiric. So we were using empiric methods. There was very limited science behind many of the things that we are doing, most of the things. And there was no standardized systems. Basically, dentists were just doing whatever they thought was the best. And a lot of improvisation and no common sense, I would say, no consensus around the procedures. That was 1.0. Of course, that as we evolved last century, decade after decade, dentistry became much more of a serious science, and universities started to really divide dental school into departments, and we started to deep dive, and scientifically prove each one of the theories to the point that we ended the last century on the 90s with, this saying of scientifically based dentistry, right? That's what all teachers try to do, teaching procedures that are scientifically proven to be the best, that went through a process of peer review or some time of research that proved that this is probably better than that this is better than the old way of doing it. But still, as we evolved into dentistry 2.0, and really got incredibly much better than dentistry 1.0, we really specialized a lot, but we were still, and we are, because dentistry 2.0 is the gold standard of dentistry still today. I would say that we achieved the apex in the 90s, early 2000, with this interdisciplinary approach, amazing perio programs, amazing ortho programs, amazing prosto endo programs, amazing surgical programs. The procedures got really sophisticated individually. But the downside or the limitations of dentistry 2.0 is that still very reactive and interventionist, right? As we know, basically dentistry today still waits for the problem to happen to then treat the problem, right? So we wait until teeth are crowded to then do ortho. We wait for decay to then restore. We wait for perio problems to then try to treat the perio problems. We wait for teeth to get bad to then extract them and place implants. We wait for aesthetics or wear to happen to then restore and make the smile beautiful again. So it is a reactive type of care. It is an interventionist type of care, not focused on longevity that much, not focused on prevention that much. You know, we do the obvious type of hygiene sessions. And probably the biggest downside of Dentistry 2.0 is that it's completely disconnected from the rest of the body. You know, still today, dentists are not exploring the body-mouth connection, the oral systemic link, and we are treating. It's very superficial, even though it's very sophisticated. You do amazing surgeries and preps and treatments, amazing restorations. It's still superficial because most of the time we are not treating the underlying problem, right? Or we are not exploring beyond the obvious. That's why I like Dentistry 3.0, caring beyond the obvious, seeing beyond, basically because we are stuck on Dentistry 2.0, just treating the obvious. We look at the patient's mouth, and whatever is obvious is what we treat.
Go back to that 2.0 before I go to 3.0. You said we were doing new techniques on average info. And so explain that. What does that mean?
So that's the way, you know, we see experts on research, experts on scientific publications, and they talk about that, right? How many studies end up being biased towards the average results, or they make us think like the result is the way to go, but the result of that survey or of that research was based on the average result between the amostrage that we had, right? So you have a situation, you have 100 samples that you're analyzing, and then you get a result that is based on the average. And the problem is that uh, the average may not be the best for that specific individual, right? So medicine and dentistry needs to be much more customized, meaning we need to understand what is the best for you, not what is the best for the average. You can have, let's say that you have a sample of 100 individuals, and uh, you have a certain issue that you want to study, and you're applying a different possible techniques, and half of the group reacts very well and generates a certain result that is at the top. If you scale 0 to 10, it's at 7, right? And the other half reacts very well with 3. 3 plus 7 is 10, the average is 5, and you may conclude that the best procedure is 5. When in fact, 5 was not good to none of them. Nobody reacted well to 5. Some reacted well to 7. Some reacted well to 3. The average is 5. So, of course, I'm using like basic examples, but you can imagine on scientific publications and studies and how things can be misinterpreted because of that, right? So, I'm not an expert on the topic, but for me, it's pretty obvious that when you get a result based on the average, you're not necessarily finding the best way to proceed when facing that issue, right? So that's what Peter Attia talks a lot about on his book. And that's why for me, your best physician is yourself, right? And if you can develop this skill of listening to you and listening to your body and making controlled changes yourself, you making control changes on diet, on behavior, on exercise, on even uh, vitamins and even medicine that you take. You know, the the doctor is saying take whatever 300 milligrams because the study shows that 300 milligrams works for most of the people in average. What is the chance that that dosage is the best for you? It's almost 0% that that's the ideal for you, right? So, and then maybe you have a better chance to understand than your physician. And even worse on medicine, modern medicine and dentistry, when everybody's on the rush, that people don't even interview you properly. Um, you become your best physician. Um, by listening to yourself and customizing whatever you're doing to yourself. People say milk is bad in average, right? Or meat is bad in average. So you need and so Dentistry 3.0 means as well that this new doctor will invest energy, will slow down and invest energy to listen and to try to disconnect from all the other patients and try to customize the experience for that patient. Customize the findings, customize the data, customize the interpretation of the data, customize the solutions that you want to propose to that specific patient.
Take us a little bit further into that at 3.0. You had mentioned how we're going to think about this differently is early intervention, prevention, reversing problems, preventing irreversible procedures. Go a little bit further with that. Like, what does it really look like?
Philosophically speaking, before you prep teeth, before you extract teeth, before you place implants, first, we want to prevent these things from happening. Second, we want to reverse issues that are already in place, right? And the irreversible procedures should become the last of the last of the last of the options, right? Of course, that many patients, all they want is to look better, or the smile, the beauty of the smile is all they want. And of course, many times we have to do procedures, even though the patient doesn't need the procedure from the health standpoint. That is cosmetics, right? That is plastic surgery and cosmetic dentistry. That needs to be placed on a bucket by itself, name it properly, no confusion. If you go to a plastic surgeon, if you go to a cosmetic dentist, you're not expecting to be healthier. You're not expecting to live longer. You're not expecting to prevent problems. You're expecting to fulfill your superficial, immediate satisfaction to look better next month, period. And everybody has the right to do that. And since everybody has the right to do that, it's okay to have doctors that are experts on that. You just cannot call yourself a healthcare provider or even a dentist 3.0 if all you care is cosmetics, right? If you try to convince every patient that the best thing is to just look better, you are a cosmetic professional. You're much closer than a hairdresser than to a real physician, with bigger consequences. So you are a hairdresser of hair that doesn't grow back, right? And you are a hairdresser of hair that is directly connected to your systemic health. And there's no problem. Um, the confusion for me, that is the problem. Pretend that you're one thing when you're another thing. Pretend that you're delivering one thing when you're delivering another thing.
And with this, I mean, you're always on the cutting edge of technology. AI is moving so fast. What we can see now is moving so fast. So if I'm a young dentist listening to this, Christian, what is this going to look like for me in a couple of years?
I'm very lucky to be surrounded by people that are deep diving in AI and using it every single day at the cutting edge of developing solutions powered by AI. And what is going on is really insane. And we talked about that. It's, you know, 2 years ago, we started to talk more about AI in terms of being scared about AI. Remember those days when we started to get scared, right? But we still couldn't imagine what would evolve in 2 years. And now we are, oops, and now we are here 2 years after, and it's just insane to see what is real, right? Just as an example, today, my team was using an AI platform to generate content with me. They gave to the platform a couple of videos of mine, 2 hours. The platform, the technology, the tool asked for 2 hours of videos of myself. And they were able to develop an avatar of myself with my voice. And you just drag and drop any text in any language, anything. And I was just reviewing it to see the quality. It's unbelievable. It's me.
You sure? Is this you right now? Are you sure?
It was me, the intonation, the way, my accent, every it's like unbelievable, unbelievable quality. Not anymore a gimmick, not anymore something, wow, this is gonna become something. No, it's here. The tool is ready. From now on, the whole team can just write text, drag and drop, and they're gonna have me uh speaking that text, right? Sharing that. Unbelievable.
Can they do the same thing but put your hair on my head and make me dress like you? I think it'd be underwhelming if I was AI, but
I knew that was coming. We've been talking about that, but to see it for the first time, right? To see it for the first time was exactly today, this morning. I was like, wow, this is unbelievable, right? So they're gonna bother me less for all the conventional content that we generate. Many things, what open space for me to think about and do other stuff, right? That's how I see it. It really frees your time to do more stuff. The other thing that happened to me recently is that I got involved in an AI project that is really out of this world. It's a treatment planning platform where you can drop the information from your patient. It's a co-pilot, right? And you can start talking to it. So we and asking questions about the case. And AI is going to speak to you like a person and is going to basically tell you almost anything about the case, right? It's going to interpret the x-rays, it's going to interpret the data, the reports, the clinical examination, the medical history, whatever information that we collect on the first appointment you give to AI, and you start asking questions. And I did the test, and the answers are unbelievable. And you're chatting, even making jokes, even interacting in a way that it's exactly like being chatting with a mentor, a coach, somebody that knows treatment planning so well, somebody that was able to read all the major articles out there, right? That was exposed to all the top information and was able to condense. So it's like having John Coyce besides you saying, look, I'm looking at the information of your patient and I think you should consider this and this. I can see that this and this and this is happening. So this is already a reality, right? The solution is out there, and companies are just finalizing the way to package this. All of these things are in beta testing phase and will be out there. I would say that in 2-3 years, it's going to become normal. Every dentist is going to have their co-pilot where you're going to chat about any situation. And the things that I've been saying, since I don't know 7 years that I've been teaching about, it makes no sense to make this a lonely decision in dentistry. You saw me talking about this, and we've been developing tools to at least to explore collective intelligence, meaning connecting you with other humans that in an asynchronous way can help you analyze that situation and give you some inputs from their experience. And suddenly you're not judging the situation by yourself, and you have 3, 4, 5 people from your team giving feedback that you can collect, interpret that, and then make a better decision. What is the case now is that AI is one of the players, right? It's not going to eliminate you talking to your mentor or your real coach or your teacher, professor. It's not going to eliminate you talking to your orthodontist or your periodontist. In that chat, in that asynchronous communication chat, is going to be you, your lab guy, your periodontist, your orthodontist, your airway expert, your plastic surgeon, and AI. AI is just one more player in the team. It's a team player. And it's probably going to become the most powerful team player because of this capacity of processing everything that is out there, condensing, summarizing, and giving you insights that, of course, still depend on your final call and common sense to decide if it makes sense or not and make the final call.
yeah. Now I know we can't. I know you have to run, but I want you to do two things for us. Actually, three things. Number one, you're going to be my co-pilot as this all changes because it's a lot to think about. And we're going to get the real Christian on here. So So you can help us navigate this because I can imagine a lot of listeners right now. It's a lot. It's just a lot to think about. And it's great to have you as our resident expert on this topic. Can you just wrap this topic up? I always love to have you wrap it up in a bow.
Yeah, I'm going to wrap it up, bringing it to an area of dentistry that you work on, that you love, that you help people with, that is the management business side. So what we've been developing and we are now starting to teach our dentists is exactly the same type of co-pilot, but on running our practice. So there is a process that you can go through where you feed this co-pilot with all the most important relevant information about your business, the way you run it, the information that you have, the metrics that you follow, what is going on. And as you feed AI with that, it becomes a helper. It becomes your coach. It becomes your advisor, basically, right? So we've been doing this, and it's really very, very powerful as well. Basically, you can ask any question. Should I do this or should I do that? What are the pros and cons, the downside, the blind spot? Tell me, try to identify my blind spots. How do I improve the metrics or the way I'm analyzing these numbers, and what do I do next? And the information and the feedback is really very, very impressive. How clean, and I would say 95% of the time, very, very interesting and very smart suggestions that are coming back. It's like a consultant. Um, so of course there's a little bit of know-how on how to feed everybody that works with AI says, trash in, trash out, right? So the prompt, how do you collect the data and you feed the data in a way that you can uh, improve this collaboration that you have with this new player on your team. So it's really unbelievable. And I will just wrap it up saying, look, don't be scared as a dentist, because if there's one thing that is going to be very hard for AI to take over, is becoming a dentist. If you could list all professions in the planet, maybe dentistry will be the last one to be replaced. I'm talking about hundreds of years ahead. I don't know. The day robots will do, and they will do decade after decade, more and more things that we used to do, right? This is obvious. I'm trying to think about a profession more difficult to replace than dentistry, and I cannot think about one. We know that lawyers and advisors and marketeers and managers and coaches and artists and even musicians, AI is already doing music, is doing art, is creating content, copywriters, attorney recommendations, guides, name it. You can already start imagining this kind of uh, solution doing the job, right? Of course, you're gonna have people always revising or confirming, etc. But dentistry, no. You still need to be a dentist and do it. So first point is that as a dentist, you should feel very, very safe. Second, you need to know that you need to leverage AI immediately, right? Connect with people that are. It makes our life easier. And honestly, companies will do all the work and solutions will come ready for you to use. I'm just saying all of these things because for us to be aware, right? It's important to be aware, to be prepared. Don't be scared. Be open. Be creative. As we had an episode talking about that. All of this crazy digital evolution and AI and everything that is going on. It's it's scary from one side, but one thing that I believe will naturally happen is that all of this will give more and more importance to real human connections, in person human connections. It's not going to make us less human. It's going to make us more human. And we're going to, year after year, we're going to value more and more in-person meetings, in-person conversations, in-person everything, in-person human common sense, human consensus, human discussions. And we will not be able, we're going to use our devices to get exposed to information, but the moment of making decisions, we're going to disconnect from the digital world because we will never know what is coming, right? So we don't know. We only know when we can touch the person in person, shake their hands, look in their eyes, and ask them, can you confirm what I think I heard you saying? So I can really know what you're thinking and we can have a discussion based on this.
Yeah, totally agree. No matter what happens, humans are relational. We need real relationships. So, hey, if you enjoyed today, do us a favor, hit the share button. Keep sending us suggestions for things that you guys want to see and topics you want to hear from Christian about. I'll line them up and ask the expert myself. So have a great day, everybody.